Welcome to Powered by Passion. Welcome to the Powered by Passion podcast series. In this exciting new series, we'll be exploring the vibrant world of nuclear through the eyes of the next generation of professionals. We are exploring the stories of young, passionate individuals who are shaping the future of the sector, whether in energy, health, safety, technology innovation, space exploration, and beyond. Nuclear is alive, active, and innovative, and the young professionals driving this change are the keys of its future. Every month, we bring you fresh insights from across the nuclear field, stories of personal growth, career challenges, inspiration, and the powerful impact that nuclear can have on our world. So, whether you're just starting your journey in nuclear or thinking about jumping in, this podcast is for you. In today's episode, we are excited to welcome Jesús Garcia Ovejero, a medical physics expert at the Clínica Universidad de Navarra in Spain. Jesús works at the cutting edge of cancer treatment, specializing in proton therapy, a revolutionary method leveraging nuclear science to fight one of humanity's biggest challenges. So join us as we discover Jesús' story, his passion for medical physics, and how nuclear science is making a life-saving difference in the world of healthcare. So, Jesús, welcome to this episode. Let's start with your career. Who are you? What led you to medical physics? And what has shaped your professional journey so far?
Well, let me start thanking you for the invitation for this podcast. I think you're doing a very good job. I think it's very important to promote the nuclear sector and the specialty of medical physics especially, so I'm very happy to be here. I don't think I have a usual career in the medical physics expert journey because I was doing some research before. When I finished my degree in physics, I did a master in condensed matter and nanotechnology. And after my master's degree, I started a PhD on nanoparticles for biomedical applications. My main interest there then was to transfer my knowledge on material science and physics to something closer to the real world application, and especially something related with health and helping people somehow. So the topic that I choose has some fundamentals on physics, like magnetism or plasmonic, but it was very focused on the target on the application. And the application was to treat cancer cells using a technique called hyperthermia, mediated by these tiny materials that are called nanoparticles. When I finished my degree, my master thesis, I continue in the research area, studying heart regulation bits using rat models, in which we use synchrotron radiation to study the structure of the heart fibers and how they contract. So it was also very fundamental studies that are always focused on the application on biological stuff and medical issues, medical problems to solve. And after a second postdoc here in Madrid, I changed a little bit my journey, and I took the medical aspects of the physics, and I started my training as a medical physics expert, working on either radiological protection, nuclear medicine, but also on radiotherapy.
Indeed, proton therapy is an exciting advancement in cancer treatment. Can you walk us through its impact and how your work contributes to this life-saving technology?
Yeah, proton therapy is a very advanced technology that has been transferred from laboratories to the medical centers. In the laboratories, we are using technologies that are very similar to CERN or these large hadron collider that are the most advanced technologies we have developed in the humanity itself. And we, in the clinic, we have taken this advanced technology, we have simplified, we have reduced the size, and we have used it to treat cancers. Not with the conventional X-ray radiation, but with proton. The main difference between protons and X-ray radiation is that in the X-ray radiation, the beam enters the patient, but it has to go out. The protons works in a very different way. They enter in the person, they start to interact with the tissues, and they leave most of the dose in the tumoral region. So we can preserve the many organs of risk that are surrounding the tumor that we want to treat. And we can do it in a more precise way, preserving better the healthy tissues.
And are you involved in any specific projects dedicated to this medical application? If so, would you like to tell us more about it?
Well, nowadays I'm involved in the clinical practice of this proton therapy, and here in the clinic we have recently celebrated our 1,000 patients, and we are very happy about that. It is a great achievement of the team. I have recently joined them, so I'm still learning the technique and improving my skills and treating patients. But there are also innovative research projects in this center. We are working on the theoretical modeling of the beam, studying interactions with cells. We are studying the toxicity effects of the therapies that we provide. We are evaluating the effect of radiation in the immune response of the patients. So there are still plenty of topics to study and to clarify that we are still working on.
What has been your proudest achievement in your career so far?
As I told you, I have had several stages in my career. When I was in a lab, maybe my achievements were more related with articles or projects that I've been able to achieve. But now in the clinics, I really remember several patients, especially the first patient I saw in receiving proton therapy. Was a very little girl, just 10 months old. And it was the first patient that I saw. And it was a beautiful girl. At that time, I had a daughter of the same age. And it was a great impact for me watching the parents next to her and feeling how can so well-developed technology change the life of this family. And how something that in the past was impossible nowadays is something real and that can really change people's life. So I think that probably in my clinical stuff and in my clinical stage, that was the main achievement that I have conquered.
Moving to the challenges you face as a medical physicist working in such a specialized and high-stakes field in terms of technology or emotional or maybe logistical.
Well, there are still several challenges. This is it's not a new technology because it has been well developed in the laboratories for a long time. But the effects on the clinical effects of this technology and the careful control of the beam, the parameters that the machine has to be in which it needs to be adjusted are still challenging. You need a very good control of the beam, a very good control of the patient position, the patient motion. We like to work with uncertainties, but we like to minimize them. And sometimes you have to deal with a hard compromise between a good treatment and a robust treatment. And And that is one of the main issues we face every day. But there are still open questions that we need to solve. This is a good technology. It has a very high potential, but still it needs more development.
And that's indeed could be one of your hopes to conclude our interview. Would you like to share some other hope that you have for the future of cancer treatment or medical physics in general?
Therapy is still a live topic in the clinical environment. We have promising results. We are very good at controlling the technology we have. But the new technologies, the new developments are very quickly transferred to the clinic, and we have to do it carefully. But there are promising opportunities for new medical physics physicists that want to join this field. There is still work to do. We know many things, but we don't know many things. So there's still some work to do. One of my hopes is to, in the near future, is to join both of my specialties, the nanoparticles and the radiotherapy, because they have the potential. The nanoparticles is a very new technology, but it has a great potential of internalizing into cells and promote the toxic action of the radiotherapy in cancer cells. So finding synergies between nanoparticles, nanotechnology, and radiotherapy, especially proton therapy, I think is a field to explore that can bring very outstanding outcomes.
And if you would like to share a suggestion or an advice for young people, young colleagues considering a career in the sector, why should they join it?
Medical physics is a recent discipline that has grown very fast in the last years, because the need of physicists in the hospital and in the clinical environment is growing and growing, and the need is urgent. So if you're a young professional, you have studied physics or some technical degree related to physics, and you're interested in making an impact on the society, helping to people directly from your work, and developing new technology that can be applied to the clinic in the near future, this is a fantastic field for you, because you have the opportunities to innovate, you have the proximity to the patient, and you have the knowledge to make the difference. So my piece of advice is that do not be afraid. You are entering in a medical world in which you will learn languages like doctor languages, nursing languages that are different from what you are used to. That is funny and it's rewarding, because you're doing something that really matters. And that's my piece of advice.
Thank you, Jesus, for sharing your inspiring journey and shedding light on the incredible impact of medical physics in cancer treatment. Your work in proton therapy and patient safety shows the meaningful ways nuclear science touches lives and shapes the future of medicine. And to our listeners, we hope this conversation has been as enlightening for you as it was for us. Don't forget to join us next time as we continue to explore the fascinating world of nuclear science and its passionate professionals. Powered by Passion is co-organized by the European Nuclear Society and the European Nuclear Society Young Generation Network, IFOM Early Careers Group, the International Radiation Protection Association YGN, and the FuseNet Association Student Council. The Cross-YGN collaboration is set up with the support of EN2+ project, the largest and most integrative nuclear education and training efforts up to date in nuclear ENT. EN2+ is funded by the European Union.